Welcome to a new episode of Medicine in 3 minutes. After here we go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's topic is about mechanical ventilation. FiO2. What is FiO2? Fraction of inspired oxygen is volumetric fraction of oxygen which is inhaled as a gas. Natural air includes 21% oxygen, which is equivalent to FiO2 of 0.21. FiO2 is typically maintained below 0.5, even with mechanical ventilation to avoid oxygen toxicity. Mechanical ventilation depends on oxygenation and minute ventilation. Oxygenation control two-factor control oxygenation, the PEEP and FiO2, and three-factor control minute ventilation. The first one is tidal volume, respiratory rate, and pressure support over PEEP. The increase of this factor lead to the decrease of PCO2. To get CO2 down, CO2 is perfusion limited. More you breathe, more CO2 go off. Oxygenation is controlled by PEEP and FiO2. That leads to the increase of oxygen. High PEEP strategy prevents de-recruitment. Positive PEEP ensure always pressure in the system, which gives to the alveoli the strength to fight back against the fluid. Treatment is prevention of de-recruitment. How to monitor that? By SpO2, pulse ox, or ABG. Minute ventilation, on the other hand, is controlled by three factors: tidal volume, respiratory rate, and pressure support over PEEP. The increase of this factor leads to decrease of PCO2. How to monitor that? By ABG, arterial blood gas, pH, CO2, and oxygen. To get CO2 down, CO2 is perfusion limited. More you breathe, more CO2 goes off. What is CPAP? CPAP is continuous positive airway pressure. It provides a constant amount of support, PEEP, positive and expiratory pressure. In this, for this example, it's about 5. And we express that by 0/5. The machine provides always 5 centimeters of water. What does CPAP not give is pressure support over PEEP. CPAP is the equivalent of PEEP. Here is 0.5 centimeters of pressure, and this is the PEEP. Two values to illustrate the PEEP. A PEEP of 5 centimeters of water and a PEEP of 15 centimeters of water. The tidal volume is the same for here and here, but there is an increased surface of the exchange in this area compared to this other. Here is alveol always closed. Here is the alveol kept open by PEEP for 5 centimeters. Here alveol is kept open by PEEP for 15 centimeters of H2 water. In endotracheal mode, CPAP mask is the equivalent of PEEP machine. BiPAP mask is the equivalent of pressure support over PEEP machine. CPAP, PEEP by machine. BiPAP, pressure support over PEEP machine. In this diagram, here is the pressure, here is the volume. The total value is 500, and PEEP is 5 positive, 5 centimeter of water. Inspiration, expiration. Here there is a negative pressure. Negative pressure means the patient trigger the vent. On the other hand, here is a positive pressure. Positive pressure means machine trigger the vent. If it is negative, it's the patient that trigger the vent. If it's positive, it's machine that trigger the vent. Here, PEEP at 5 mean pressure, alveolar pressure do not fall below 5. Here, negative pressure starts first, then the volume start to increase. Here, pressure positive, that's a machine trigger the vent. That means the patient is comatose, is the machine that doing the work. Here we are in volume control. If pressure increases too much, an alarm will be triggered. This chart is to understand the flow. We compare the flow to a velocity of a car. Acceleration equal delta V over delta T. Delta V is velocity and delta T is time. There is acceleration, plateau, and deceleration. Flow is delta V over delta T. Delta V is a variation of volume over variation of time. The flow gives us inhalation and exhalation. Inhalation and exhalation. Resistance versus compliance. The airways are symbolized by a straw and the lung by a balloon. What is compliance? Variation of volume over variation of pressure. High compliance, that means small pressure but high volume. High compliance, small pressure, high volume. The volume is high, the pressure is small, it gives high compliance. On the other hand, if high pressure and small volume, it gives low compliance. Low compliance, high pressure, small volume. Here we are in presence of PEEP and peak inspiratory pressure. This is the maximum pressure of inspiration. This peak pressure of inspiration gives the resistance. And then we have a plateau pressure. And plateau pressure gives us compliance. Peak inspiratory pressure is the highest level of pressure applied to the lung during inhalation. Plateau pressure is the pressure applied to small airway and alveoli during positive pressure mechanical ventilation. It is measured during inspiration pause. in ARDS, maintain plateau pressure lower than 30 centimeters of water measured in ventilator. We are here in plateau pressure, and here is a peak pressure. Peak pressure, plateau pressure, and resistance. In the ventilator mode, assist control, respiration rate is 14, tidal volume is 500, FiO2 40%, and PEEP 5. When you are controlling the volume, you keep an eye on the pressure. When the pressure rises above a certain limit, an alarm will go off. There is problem. Is it a peak pressure or a plateau pressure? Here is about the peak pressure. Here is about the plateau pressure. Pulmonary ventilation versus alveolar ventilation. If there is increase in peak pressure, it's increase in airway resistance. Asthma, mucus secretion, or occlusion of tip endotracheal tube. On the other hand, if there is an increase in plateau pressure, that means decrease in lung compliance. Tension pneumothorax, pulmonary edema, pneumonia, and ARDS. Shallow rapid breathing. Hyperventilation could reach only the dead space, not respiratory zone. On the other hand, deep, slow breathing increase alveolar ventilation. Deep, slow breathing increase alveolar ventilation. Pulmonary ventilation rate increase only the dead space. Raising the respiratory rate too much, the patient will stuck air. It's auto-peep, obstruction, asthma, or COPD. Inspiration, expiratory time. Here is the normal, and here is the auto-peep. The risk of increasing respiratory rate could cause air stacking, auto-peep, or asthma COPD. The risk of increasing tidal volume, there is a risk for inflammation in ARDS. The increase of FiO2 could lead to oxygen injury barotrauma. The increase of PEEP, low venous return, low cardiac output, hypotension. Increasing the respiratory rate, look for asthma. Increasing the tidal volume, risk for ARDS. Increasing FiO2, risk for barotrauma, oxygen injury, and increasing PEEP, risk for hypotension. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the like button and subscribe? Your comments are very welcome. Thank you.